Good morning. I am Dr. Arnab Pathak, consultant psychiatrist, currently practicing at Kolkata. I want to deliver you some information regarding suicide prevention on the occasion of World Suicide Prevention Day. Suicide is a problem since eternity, and it has been seen in the recent decades. We are seeing there is an alarming rise of suicide rates. And earlier, Western countries and developed countries had a higher suicide rate compared to Indian subcontinent or the developing countries. And the hypothesis behind it was Indian subcontinent had a better familial support or social support in compared to the Western countries. But with modernization of our lives, our globalization, we are seeing that this difference has faded, and Indian suicide rate has increased to become at par with the world suicide rates. If we go into the causes of suicide, we will find that suicide has a major cause in the general population as familial problems, and that is 36%. And if we come into the patient in mental illnesses, anxiety and depression has a major part to play in suicide. Now, our friends and family support is very important, and I want to deliver you a strong message regarding this, that patients suffering from anxiety and depression mostly need this support. And what the problem we do regarding assessing the problem of our friends and families is that whenever we see a person suffering from anxiety or depression, we try to make their problems look smaller by commenting like this is a very small thing to worry so much. For this much, why are you behaving like that, or you are reacting so much? That is our main concern, that this problem is not that much that this person should suffer this much. We assess whether the reason or the justification of this suffering is correct or not, and we miss the agony through which the person is actually going through. And that is the reason what happens whenever a person is in mental illness and he is suffering, we fail to assess the condition of the person, because we assess the condition by looking after not the person but the problems. But we should know one thing: in mental illness, it is not like that. Uh, if you have heard about generalized anxiety disorder or panic attack or phobic anxiety disorder or OCD, you will find one thing, that a very small or trifle thing for you, that is there is a dog nearby, or you are in a close place, and that person is actually shivering like he will die. So our reaction will be like, what is this? We laugh at that person, we make fun of that person, that why are you so much afraid? But that person is suffering. We should understand that thing. Suppose a person is depressed because he has scored bad marks, or because someone has left from his life, and we will say that, oh, okay, that person is not that important, that person was not good, that many things we say. And also we try to console the person by saying that make your mind stronger, don't be depressed, and this is a very temporary thing. I understand these are already obviously very correct things to say, but the thing is that not to that person, because that person has not created the depression. Depression is not something we try to like go into, or not something we have created. It is a condition you're suffering from. So we should understand that person is actually in a condition we should. And I have seen that persons who actually comment like this, that is not there, they are not like loving or caring for that person. If the same person is having common cold, they will be very caring for that person. That is a very irony I see about mental illness. Okay. Some of the cases I have seen that in persons commit suicide, and the person was depressed for a few months before this committing suicide, and the person was not attended to any professional psychologist or psychiatrist for that reason, and that person was not like treated completely or seriously for that. Okay. So that is a major part I should like comment on, that while assessing someone, you don't need to be a doctor for that. You just need to be a like empathetic, compassionate way to like understand the problems, like what are the problems the person is facing in his mind, or he's like suffering from, like he has decreased sleep, he's feeling low, like why he's feeling low, that is justified or not, that situational or factual cause is justified or not, we shouldn't go for that. The simply we should try to console the person, try to make that person active, try to make that person engaged in different work. We should try to make that person go to visit a psychiatrist or a psychologist, whatever you like. Or if the person is actually suffering, like he's severe and we see there's a suicidal intention, or the person is like his functionality in the society or his surrounding is like in a problematic situation, you should refer to the psychiatrist. But what we should not do is not to pass comments regarding his problems. So with this, I will end my this lecture and on suicide prevention. And I think in the whoever is hearing this message, you will do accordingly. Thank you.